So how is the mental health of women different from men? So in this regard, as my previous speaker had very rightly and elaborately discussed, there are factors like social factors, biological factors, and cultural factors. So if we think about the social factors, still India is mainly a patriarchal society we are living in. So men's both physical and mental health are prioritized. But when it comes to mental health of women, it is still an very neglected entity. If women of some family feels sick, then they consult a doctor regarding the physical signs and symptoms, which are sometimes given attention, although much less prioritized compared to the male counterparts. But when it comes to mental health, in our society mainly, it is often overlooked or often not given the priority as it should be. Now, coming to the biological and hormonal factors, we all know that the female hormones like estrogen, progesterone, they all have an effect on this mental well being. So, if we see the disorders like mental health disorders, they have a relation to the menstrual cycle also in case of females. So, it is because of this hormonal factors. And coming to the cultural factors, as my previous speaker has also discussed this part too, that there are some taboos in different society, there are different cultural norms which prevent the females from accessing healthcare unless it is an absolute emergency. So all these factors make women health itself a different entity from men. So what is the problem magnitude? As my previous speaker also told, that according to the World Health Organization report of 2001, depression disorders account for around 50% of the disability from neuropsychiatric disorders among women compared to around 29% among men. So it's almost double. The prevalence of depression in women is almost double compared to men. Leading medical health problems of elderly are depression, organic brain syndromes, and dementia. Majority of them are again in women compared to the males. So an estimated 80% of 50 million people affected by violent conflict, civil war, disaster, and displacement are either women or children. So if we see the lifetime prevalence rate of violence against women, it ranges from 16 to 50%, varying from the different countries. It is much higher in the low socioeconomic status and in the developing countries, but the scenario is not too good in the developed countries too. So at least 1 in 5 women suffers an attempted violence in their lifetime, which is also a significant number. So the problem magnitude, depression, bipolar disorder, stress and anxiety disorders, they affect the female counterparts more compared to the males. Like symptoms of depression, anxiety, and unspecified psychological stress are almost 2 to 3 times more common among women than among men, whereas disorders like addiction, tobacco use, substance use disorders, and psychopathic personality disorders are common in men. So, apart from the substance use and these disorders, some major disorders like depression, stress, and anxiety are much more common in female compared to the male. So, one important thing that should be stressed upon is the mental health and the menstrual cycle. As I was talking in the beginning of my presentation, that hormonal factors play an important role in regulating this mental well-being of a female person. So, mood and behavioral changes have been observed to be associated with menstrual cycle since very ancient times, as reported in literature. The symptoms like irritability, restlessness, anxiety, tension, migraine headache, sleep disturbance, sadness, dysphoria, and lack of concentration occur more frequently during the premenstrual and the menstrual phase. A premenstrual dysphoric disorder consisting of extremely distressing emotional and behavioral symptoms is closely linked to the luteal phase of the menstrual cycle. So, this menstrual cycle, which occurs at the periodic intervals in females, the hormone levels, fluctuating hormone levels, have a significant effect on the both on the physical health and also on the mental health of a female. So, perinatal mental health, this is another very important issue and oft neglected entity. Postpartum blues, postpartum depression, and postpartum psychosis. This it is actually a spectrum of disorders with mild to the extreme range. These three things like postpartum blues, depression, psychosis, They represent the end of the spectrum. That is the major psychiatric illnesses. But postpartum blues is the most common and least severe postpartum illness, which affects around 50 to 80% of new mothers, which is a significant number. So this slide is to underscore the fact that in our society, particularly in the developing countries, postpartum maternal health is often neglected. When a female person who has given birth to a child recently, she is complaining of she is not feeling well mentally. People neglect, and the other seniors of the family, mainly the female seniors of the family, they say that this is not an issue. You can cope this with time, but this is not so. It is an equally important psychiatric problem and itself an entity, like the disorders like depression, like this postpartum depression, postpartum blues, postpartum psychosis, it itself an identity and also be treated as such as a disease and not just that it is a feeling which can be overcome with time. Postpartum depression constitute a major depressive episode with an onset within 6 weeks postpartum in majority of cases. It sometimes so happens that it becomes so, it can go to that extent that a female person who has recently given birth to a child, she might commit suicide also. Suicidal attempts are also reported in literature in extreme forms of this postpartum depression and psychosis. So this is an important entity, and when a female who has just given recently to a childbirth is complaining of some mental health issues, it should be prioritized and one should be careful and vigilant enough to do this. Sorry. So, in India, depression occurs as frequently during late pregnancy and after delivery as in developed countries. But this cultural differences is what makes it different as a disease. So, substance use and women. So, although the rate of substance use disorders is less in females compared to males, still it should not be overlooked upon. So, although there are variations between countries, rates of substance abuse, particularly alcohol, tranquilizers, and analgesics, are increasingly being reported worldwide. Women are more likely to attribute their drinking to a traumatic event or stressor, and women who abuse alcohol or drugs are more likely to have been sexually or physically abused than other women. Significantly more major depression and anxiety disorders are found in females with alcoholism. Thus, the profile of women with substance use problems differs from that in male abusers. However, despite increasing rates, services to assist women are very limited because of the various factors, as already mentioned by the previous speaker. So, the mental health and well being, apart from the physical health, is directly linked to the female's children health and well-being, because mother is the caregiver. She is the one who is the first teacher and nurtures the children. So if a mother is not mentally sick, she cannot raise her children with appropriate physical strength as is necessary. So we often give importance to the physical health, but mental health is an equally important entity of mothers, and it has a direct impact on the children's health and well-being, which should be emphasized upon. So, what are the challenges? So, as my previous speaker has already told, there are various challenges. Like in the developing countries, there is lack of access to healthcare. Financial constraint is a very important thing with a low socioeconomic status. Physical health of the male persons are given importance, but when it comes to female persons, unless the disease is very severe or the person is very symptomatic, then the females are not given due importance in the lower socioeconomic status. And when it comes to upper socioeconomic class also, physical health is given importance, but mental health is an often neglected entity till date. So what can be done? So many things can be done. There are many organizations coming up, many associations, many rules, many laws, but still the scenario is not very changed. So the answer, my friend, is blowing in the wind. We know the magnitude of the problem. We know what we should do and what can be done. There are also lots of rules and regulation. But when it comes to practical implementation, it is often neglected. When it comes to our own family also, still we can give a lot of talks everywhere, but still when it comes to our community, our society, we are still lagging behind in this aspect. So mental health of women, apart from the physical health issues, is a really challenging issues, and we should be very cautious and vigilant enough to do a total psychiatric assessment of all the female patients coming to our clinics, especially if she is complaining that her mood is low. We should not overlook the entity. We should refer her to the psychiatrist who can detailed evaluate her. And psychological counseling in its many cases is of utmost importance. So, apart from the physical symptoms and signs, any mental symptom or sign, if the patient says or if we can suspect, it should be given due importance. And so it's high time that from an often neglected entity, we convert it. It's our duty as caregivers and physicians to raise awareness in the society and to convert this often neglected entity to an often prioritized entity. So, thank you.